Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Well, one thing that we know, especially when it comes to the forefront of the COVID pandemic fight, is the face and the efforts that have been made by Dr. K Sudhakar. He's a medical education minister, but also, more importantly, he's one of the persons who, for the Karnataka government, has set several standards in how to tackle this pandemic. And I'm saying standards also because innovation has been one thing that Karnataka has stood out in the way it has handled the pandemic. He has headed that. Apart from that, being a doctor himself, a practicing one, that too has understood the situation better. And that way, it has strengthened Karnataka as a state compared to other states in the country as to how it has managed COVID-19 till now. But I today will be speaking on Bengaluru as a city because that is one of the examples of how a city can control the pandemic in a way and keep it much lower. And I'm talking about much lower in terms of numbers compared to metro cities like Delhi, Mumbai, Chennai, Kolkata, and it's not comparable to other smaller cities because Bangalore's population is around 1.3 crores. Thank you so much for talking to us here at The Print. My first question, how has Bangalore managed to keep its numbers so low in terms of mortality rate, in terms of how it has, in terms of number of people who have been also infected? Why is it so?
Firstly, thanks for the appreciation. Bangalore so far it's so good. As a minister, I should really tell you still this pandemic is not over yet. But Bangalore with 1.2 crore people, even today we have 700 plus active, out of which at least about 50%, close to 50% people are recovered completely. To have this small number in city, we initiated all our preventive measures well in advance. Some states could not, they behaved little late. They started taking measures quite late. We took the measures 10 days before any others could take it in this country. So like closing down of malls, schools, institutions, pubs, wherever the places of a lot of assemblies were there, we started containing those. Similarly, we started tracing, surveillance. That is, in the international airport, we started testing people, screening people as early as in February itself. So the first case in Bangalore or Karnataka, we got only in the March 8th, if I'm right.
Yes, March 8th.
So that was our first case which was noticed. So the 5 principles of T we have implemented to our fullest satisfaction. Like tracing and tracking were brilliant, using our police officers, the health department officials, the use of technology, and the 4th and 5th T's like testing and treatment has been brilliant. So these 5 principles of T we could manage with use of technology, with the use of the right human resource, with the use of the allocation of funds, and the leadership of our chief minister. He was all in all, he was very cooperative. He is cooperative, and he had told me to go about fully. So he had given me a complete freedom to do the way that we think it is better. So as a group, as a team, really it is a team's work.
Right. You make an important point about saying that we are still yet to see a lot more cases, a lot more surge. I understand what a peak is, and we haven't. India as a country is still escalating. We are still yet to peak, like other countries like UK and Europe. What do we need to do in terms of Bangalore? Contact tracing, primary, secondary contacts have been done, but testing has reduced. Why?
See, firstly, I beg to differ you by saying that we need to see a surge in India.
Okay.
See, when we compare this past 4 months of our experience, in the first 2 months, wherever, be it US or in other European countries, in 2 months there was a sharp spike. Soon after 2 months, there was a decline, there was a flattening, but there were number of deaths. As like from 5%, it varied from 5% to almost even 15% in some countries. But when you look at our national figures, it's not beyond 3%, 3.1%. When it comes to Karnataka, it is not more than 2.1%. So why I beg to differ you is the severity of this transmission and the infection is not as severe in this state or in this country as when you compare to other countries. This is my wild analysis. I am not saying this with concrete evidence or with considerable study on this. But this is, as a minister, I've been observing and I've been trying to collate in the information and trying to compare the information. So to that extent, I feel there is something in India where the severity of the virus is not as aggressive, as severe as in other countries.
Okay.
Secondly, the number of positives will go up. I will also agree to your point, but mostly 90% and above, they are all asymptomatic. That is the classic difference from Indians to other countries, other nationals. So that is why regarding preparedness and especially about the testing protocol that you asked, yes, we were testing about 15,000 tests per day because there were a huge influx of interstate travelers from Maharashtra, be it Gujarat, Tamil Nadu, the neighboring Andhra, Telangana. We are surrounded by 6 states. Our state is a landlocked state between these 6 states. Unfortunately, all our surrounding brothers of the states, they were infected, high cases. So they all traveled. When they all traveled, we wanted to make sure that we test everybody. So that is why in those days when they had traveled, we started testing more. After 15 days, it has come down. The influx or coming in is come down. So the test sample is also reduced. It's not intentional. The testing capacity of the labs has increased from 2 labs to 71 labs. From 200 tests per day, we can test up to 15,000 tests. So that is our capacity building that has happened in our state.
But you plan to now scale that up because
we have taken yes, you are right. We have taken a principal decision today after meeting all my senior officers and technical experts, subject experts. I took a very hard decision of testing minimum 15,000 tests in a day. And if it is a pooling test, it could go up to 25,000 tests per day as well. So the sample size, the sample varieties have been increased. They have been included now. Various groups in the society. Such groups in the society is also included for testing criteria.
Okay.
For example, Paurakarmikas, street-wide vendors, people who are working at the counters of the billing and other things in the supermarkets, delivery boys of various e-commerce to, what is that, postal, this thing, and any kind of service provider, the delivery boys to the household or the offices, they should be checked. And all our police department officials who are on the ground, health department people, the Asha Karyakartas, the education department, BLOs, and most importantly, all those who are above 50 years, who are symptomatically ILI cases, they need to be tested in 100%, fully.
How do you plan to do that?
We have formed various task force committees right from village to the block level in the BBMPs or any corporations. We have made thousands of committees. Each committee comprising of health personnel, education from educational personnel, and similarly a police constable or somebody. So like this we have constituted a committee. So there are about more than 800 committees in Bangalore alone.
Would this be door to door?
Of course, they have to do door to door.
And based on the census.
And we are using technology also.
That's my next question, because Bangalore runs on apps, and it is technology that has actually helped you in more ways than one. From Quarantine Watch to Corona and Watch and all of them. How did this whole concept of technology join hands along with this whole pandemic management?
See, we have a privilege of having a Silicon City in our state. Silicon City has innumerable strength, the amazing strength in producing a lot of people who are tech savvy. Luckily, I have within my team there are some officers who are again tech savvy people. Like one who heads my war room is a tech savvy IAS officer, Mr. Monish Modgil. So right from the day one, we have been very techno savvy. We are using technology, and this has been helping in a great deal to control this pandemic, especially in quarantine facilities, in surveillance, in tracing people, in tracking people. So including the treatment protocols, like yesterday and last week we started what is called this HD camera online tele ICU. So there is a camera placed in every bed of the ICU. This is monitored centrally from Bangalore with our central experts.
These are the EICUs that you're talking
about. Tele ICU. Yeah. So like this, in every facet of this principles of T, we have used technology to our advantage.
But as far as in terms of taking it forward, how do you plan to take this in terms of controlling it? You're saying there is a time when possibly you're looking at a plateauing, because like you said, you differed with me in my opinion saying it may surge. So is it a plateau that we're looking, and how are we going to take it forward in terms more aggressive testing, more screening, or is it a lockdown?
See, as a medical doctor and a medical education minister who is handling this COVID in this state, my first priority is to save life. I want to ensure people who are symptomatic should be treated first. They should not get to ICU or the later stage ventilator. Our experience on ventilator has been very bad. Those people who are ventilator, nobody has come back from COVID. I'm not talking about the other issues. Those who were COVID infected with other comorbidities who were on ventilators, they have not come back. They've all succumbed to it. So the first and the most important facet of this whole handling situation is we need to ensure people will not get into that stage of ICU and ventilator. We need to aggressively treat them and ensure their recovery much before. For that to happen, we should trace them first. We should track them first. Then we should test them. The four principles of T is very, very, very important. If that we do it, then I think most of the ILI cases, at least the more percentage in ILI cases, they are turning out to be COVID positive. So you identify who are ILI cases. Such people should be tested, then they should be treated accordingly.
With the high surge of cases, Chennai has gone into a lockdown. So would that mean the state also, a lockdown, has that helped? Will it help in the long run as well?
See, lockdown can only help for the healthcare systems to prepare themselves to upgrade their bed capacity, ICU facility and other facilities to handle the situation. Secondly, it also helps in a way to control the spread of this virus. Virus as it is doesn't move.
Is this
it moves with a individual mobility. When you move, the virus moves along with you. So that is why, to that extent, it stops the spread. So I think that cannot be a permanent solution.
Are we heading to another lockdown?
I think Bangalore doesn't require another lockdown yet. So I am very optimistic. I feel that going forward the way that we are, we should be able to control it. Of course, this is most importantly, I would like to say, with the civic sense and responsibility of my fellow citizens. Unless they cooperate with the government and ourselves, we can't really do it. No government, no society can do it unless their civic sense prevailed, citizens cooperate.
As we unlock down, a lot of workspaces are opening. And there have been, again, technology and apps that have been devised by the state along with ISC to help in detecting all these. But how do you think you are going to manage, especially with Bangalore being an IT city, with a lot of them, IT companies being work out of home, but they will at some point of time come back. We don't know what the pandemic is going to turn out at that point of time. What will be the measures for workspaces?
See, with the workspaces or any other spaces, we have already issued a guidelines. Like masks, wearing a face mask is a brilliant solution for this. This is what even World Health Organization has just announced a couple of days back. This can reduce 80% of the infection spread. This is like one brilliant solution. Everybody should mandatorily wear it, and they should, inculcate this system in their lives till we get a suitable vaccine, a specific vaccine or a specific treatment for this. Till then, the mask is a compulsory thing. The way that we wear to cover ourselves, face mask is another thing to our addition.
That's my last question in terms of vaccine, because something that remdesivir has been used and others as well are being used in combinations. But when do we see a vaccine or any medication to help COVID?
See, in my experience, in my understanding, any new medicine or a vaccine for this, since the globally all scientists, all R&D centers, brilliant institutions are working tirelessly on this. Day and night they are working on this. I'm very optimistic and hopeful that something will come out. I think before the next June 2021.
Will Bangalore lead in that as well?
I think so. A lot of institutions are taken up this challenge. In fact, our 25th year RGHS University, we inaugurated by the Honorable Prime Minister, that is the hackathon.
Yes.
Yeah.
Well, thank you so much for talking to us, sir.